Welcome to this important webinar on vector-borne diseases organized by the Infectious Disease Alliance. My name is Iris Klaassen and I'm honored to be your host today. Today we will talk about vector-borne diseases. We will start with some opening remarks from Rodrigo Scottini, who is our executive director. And after that, we will talk with Nelika Malevic, who is on public health preparedness for dengue, and Mayani Edward on the impact of climate change on vector-borne diseases. After that, there is a panel discussion, a Q&A session, and some closing remarks, also by the IDA. I want to say that every speaker has 10 to 15 minutes for the intervention, and everyone who has some questions, they can raise their hand, and at the end we will answer these questions during the Q&A session. So thank you for joining everyone on this important conversation with each other, and let's get started. I will give the word to Rodrigo Scottini. These are the opening remarks. Yeah. Okay, Rodrigo, over to you.
Thank you, Iris, and hello, everyone. I'm the Executive Director of the Infectious Disease Alliance, which is an organization hosting this event here today. So the Infectious Disease Alliance, for many of you who haven't met us before, it's an organization that's committed to tackling some of the world's most urgent and complex infectious disease challenges through a combination of cutting-edge research, innovation, and cross-sector collaboration. We work to develop sustainable solutions and apply advocacy tools to help the infectious disease community. Our efforts focus on strengthening disease surveillance, enhancing diagnostic capabilities, advancing treatment options, and advocating for policy reforms that prioritize infection diseases prevention and control globally. At the heart of our mission is the belief that collaboration drives progress. By bringing together leading scientists, healthcare professionals, policymakers, and community leaders, we foster a multidisciplinary approach that ensures our strategies are both evidence-based and locally applicable. Through partnerships with public, private, and non-government organizations, we aim to accelerate the development and implementation of effective solutions that reduce the burden of infectious diseases globally. Vector-borne diseases pose a growing global health challenge, affecting millions of people each year, particularly in low-resource settings. Those diseases, transmitted by vectors such as mosquitoes, ticks, and sandflies, including malaria, dengue fever, Zika, Lyme disease, and chikungunya. Historically confined to tropical and subtropical diseases, vector-borne diseases are now expanding into new geographic areas due to climate change, urbanization, and global travel. So, warmer temperatures, changing rainfall patterns, and altered ecosystems are creating more favorable conditions for disease-carrying vectors to thrive. The shift has led to increased outbreaks in regions previously unaffected, putting new populations at risk. Vulnerable communities, often with limited healthcare infrastructure and inadequate vector control measures, are disproportionately impacted. Despite the significant public health burden of vector-borne diseases, they frequently receive less attention and funding compared to other diseases. That's why it's a high focus for us here today. I would like to introduce our organization in a bit more details for some of the people here today. So if it's okay, I'll share my slides. Let me see if I can start sharing. Just give me a second. Yes. So you have heard about the Infectious Disease Alliance, what we do, and what we are aiming for. I would like to really call the attention of the organizations here today that are from civil society, that our mission is to unite civil society globally. So we're really opening that opportunity for you to become part of our alliance. It's free of cost. You can really easily go on a website, join the alliance, and fill out the form. So please, not as an individual, please join as an organization. Take this opportunity for your management and offer them this opportunity for joining us and being actively involved, as we represent organizations globally. So we give access to critical tools, opportunity for alignment, and we provide access to resources and accessibility for advocacy and so on. So here is slide why we exist. We kind of we kind of like help civil society have joint representation, unifying them from working in fragmented areas. Collaborative partnerships is a very important aspect of our work. We really would like to see who are here today and invite you to join our conversation. So in a bit, since we are not more than 20 people, I would like to propose to have to take 5 minutes to briefly have a round of introductions here, just your name, your organization, and if you can turn on your camera for like a second to have like this feeling of community. We would like to have a more like a forum style and not only like a front and panel perspective. So our members are civil society organizations and supporters of foundations, private sector and governments, and engagement partners, international organizations. So if your organization is interested to join us, this is a list of benefits. Then I'll jump to the areas of we work on. So please have a closer look on the areas we are working. There might be other areas that are of interest for you. Then the events are here. The physical events taking place this year. If you're being at the World House Assembly later in May, please contact us. We have a couple of events there. If you're in Europe and want to attend the vaccines event in the European Parliament, let us know. And there is an event at UNGA, an event on global health finance at World Health Summit and European One Health Conference in European Parliament. Yes, those are the list of webinars, including this one here today. There'll be a series of webinars for the rest of this semester. Please go to our website to register the upcoming ones. And yes, this organization, you can also see us on our website, our strategy. So I'll now jump to have a round of introductions. So I'm the executive director. If you don't feel comfortable introducing, that's fine. I'll give the word to my next colleague to introduce, and then we can start rolling the ball. So I'm the executive director of the Infectious Disease Alliance, and I live in Copenhagen. Then over to Carl.
Yes, thank you. My name is Carl Arian, and I'm based in Copenhagen, like Rodrigo, and I'm in charge of the community management team in Infectious Disease Alliance. And over to our speaker, the first speaker, Nilika.
Hi, I'm Nilika Madhavike. I'm academic in the University of Sri Jayawardenepura in Sri Lanka and been working on dengue and other vector-borne diseases for a while. Thank you.
Maybe we can roll the ball to Efremia, and then you can roll it further, Efremia.
Yes. I don't know if you can see my camera. Okay, my name is Efremia. I'm based in Copenhagen as well, and I'm the committee manager for zoonotic diseases and One Health.
Okay, maybe we can go over to Mayani then.
And then you can need someone.
Mhm. Mayani Edward, can you introduce yourself? Maybe someone else. Sarah Almeida. Someone else.
Yes, I can introduce myself.
Thank
Can you hear me well?
Yes.
I'm a PhD student at the University of Copenhagen, and I'm doing a project on viral disease transmission in Bangladesh and local communities. Yeah.
Over to Tatiana Jackson. Maybe she's not ready to attend. Ellie Sutcliffe.
Hi, I work for an organisation called CEPI, which is a coalition for epidemic preparedness and innovation. I'm the epidemiology and data science department project manager and also the strategic lead on the climate and health initiative. Happy to meet you all.
Thanks, Ali. We are in contact with your colleague Vilo in Brussels.
Ah, okay. Well, nice to meet you.
Yeah, nice to meet you. Then Yuk.
Hi, I'm actually Ellie's colleague in CEPI. I work under the policy team, and so I'm the policy lead for the climate change and health, and also I wear another hat, which is the CSO focal point within the policy team. So Willow has actually talked about introducing you guys to us, but I'm glad that we're meeting here now.
Sure, we'll certainly follow up with a meeting later on. Thank you, Yuk. Who else? Maybe Natalia Garzon. I don't know if you're around.
Hello, I'm Natalia. I'm part of the membership associate of IGA. I'm anthropology and living in Spain, and it's a pleasure to be here and hear you.
Hafisa Fadila. If you can hear us. Otherwise, let's try Irenia Nicholson. Or Jeremiah, I don't know what's the pronunciation. Well, might be let's test a last one. So maybe Suzanne Ripanilis.
Hi, I'm based in Berlin. I am a veterinary medicine vet, and I am also a risk management manager, and my focus plays on One Health and actually newly also the science transfer to the praxis and to the economy. Thank you. Nice to meet you all.
We have a team in Berlin of 5 individuals. Feel free to reach out to us. There will be, and I believe you're Greek, so I'll have a lot of Greek people in the organization as well.
Yeah, I'm Greek. I'm half Greek actually, but yeah.
Yeah.
Yeah, you're coming in Berlin?
We have a team in Berlin. We can connect you with them later on.
Okay, thank you.
Yeah. And the last one, Mukuhi Mutumbi.
Yes, hi, my name is Esther Mukuhi I'm an epidemiologist working at the Khan University in Nairobi at Cameron Community Kilifi. I work on infectious disease epidemiology, focusing on enteric diseases and antimicrobial resistance. Thank you.
I think we went, and then maybe Daniel Bausch.
Yeah, afternoon, everyone. Daniel Bausch. I'm based here in Geneva, although I've had a number of different roles over the years in pandemic response and preparation at US CDC and WHO and UK Public Health Rapid Support Team and various others. Presently a visiting professor at the National University of Singapore and also a past president and past scientific program chair for the American Society of Tropical Medicine and Hygiene. Nice to be with you.
Thank you. We're also in contact with Jimmy Chill from
Jamie. Yeah, sure.
Jamie,
Yeah.
yes.
Yeah.
Thanks for being with us today, Daniel.
Sure.
If anyone is that joined later, I'll give the opportunity one last time to Kulja Joseph and Majami Edward. Please speak up if you're around. Otherwise, I will give the word back to Iris to continue the moderation.
Okay, thank you, Rodrigo. I want to introduce our next speaker, Dr. Nelika Malavic. She is an speaking about the public health preparedness for dengue in a changing climate. And yeah, she works as a professor at the Department of Immunology and Molecular Medicine. So I'll present my screen again, and then we can continue. See. And then let me see. Sure. Okay. Dr. Nelika, do you wanted me to present, right? Then
Yes. So
great. I give you the word.
If you can move on to the first slide, please. Okay, so I'll be talking about public health preparedness for dengue in a changing climate. If you can go to the first slide. I think people who have joined here would have heard about dengue. And as I gathered, most people are not living in countries where you have dengue who have joined in this forum and have not experienced what dengue outbreaks are like and what it feels like to be living in a country where we have continuous dengue outbreaks, which are increasing intensity every year. But just to let you know where we are, so the graph in your left shows the number of cases in 2024. And as you can see, it's in Latin America, Asia, and now in Africa. So Africa was not affected very much until about 2019. But as you can see now, dengue is also reported in Africa. And these are the countries where the dengue vector, which is Aedes mosquitoes, are prevalent. And in the figure on your right is about the number of cases per 100,000 population. And again, it's the same countries where the dengue mosquito is prevalent. And as you can see, most countries are reporting a prevalence rate of more than 500 cases per 100,000 population, which is a very high rate. And because of this, the WHO has classified dengue as a grade 3 emergency. I mean, they classified it last year, 2024. And in the WHO R&D blueprint, which they released last year, and I was also involved in the flavivirus group, dengue has been classified as a pathogen of pandemic potential. Next slide, please. And of course, a lot of people believe that dengue is a mild illness. The vast majority of dengue cases are asymptomatic, and most people developing dengue fever. But it is when the numbers of cases increase and the hospitals get overburdened, then of course, managing dengue patients can be very challenging. And then, of course, you get these increase in case fatality rates. So many countries report case fatality rates, which is the number of people who die, who get dengue, who are clinically diagnosed with dengue, which varies from like 0.1 to 1%. But just to let you know, when you have outbreak situations, how mortality rates change. Bangladesh, for instance, experienced a really bad outbreak in early 2024 and in the latter part of 2023. And the case fatality rate was like 1%. So, which means for every 100 patients, 1% dies, which is a very high mortality rate. So when you don't have a lot of cases, yes, you have low case fatality rate, but when you have lots of cases, the fatality rate increases. And as of 2025, globally, almost 400,000 cases have been reported in January alone, with 273 deaths. But these figures are very much not the reality, because many countries don't report dengue and also don't report deaths. Some countries only report PCR confirmed dengue. And as you know, in many of the countries that are involved due to dengue, these tests are not routinely carried out. So these numbers which are here of January 2025 are not the actual numbers. It's very much underreported. Next slide, please. So there's a big question, okay, why is dengue rising? Dengue has been around causing outbreaks in Asia for the last 70 years, but it has been gradually increasing, affecting, moving to Latin America, and I said now causing quite big outbreaks in Africa. Burkina Faso was very much affected in 2023 and 2024. And we also saw an increase in not just travel-associated dengue. Of course, travelers from countries where you don't have dengue because of, because they are cold climates, when they go for holidays in countries which have dengue, and they do bring back dengue, and that's travel-associated dengue. But apart from travel-associated dengue, we did see dengue, locally transmitted dengue happening in Spain, France, and Italy in 2023 and 2024. So why is dengue increasing? Of course, climate change is an important factor, which I'll talk about a little more. The virus, of course, viruses evolve to keep on infecting and transmitting in a better manner. And so there are two types of mosquitoes that transmit dengue, which are the Aedes aegypti and Aedes albopictus. And Aedes aegypti has shown to be more competent in transmitting dengue than albopictus. And so Aedes aegypti is seen in very urban environments. So rapid and unplanned urbanization also contributes to increasing these vectors. Then we have population factors like fragile health systems, large migration of populations, humanitarian crises, which again increases incidence of dengue. And you see, you have with these climate events like massive flooding event or El Nino followed by a massive flooding. These extremes of weather actually drive these dengue, and you always see after massive floods dengue outbreaks in different countries. Next slide, please. So in 2019, it shows your figure on your left where you got dengue. The blue highlighted countries, regions are where you only have dengue in certain months. So like 1 or 2 months, which would be the summer months. And in that, you do see certain regions of US, certain regions of Europe are seeing dengue or transmission of this mosquito in 1 or 2 months per year. But what is projected is by 2050, with the increase in global temperatures, you see many other countries in Europe and many states in US being affected by this. And of course, you have longer duration of transmission of dengue. So of course, this is how dengue is spreading around. And although this may sound like a bad thing, because Europe and US are affected, somewhat now, there's been more focus on dengue, and dengue, which was a very much neglected infection, has finally got a little bit of attention from high-income countries. Next slide, please. So how does climate change affect Aedes mosquitoes? Of course, you don't have mosquitoes in very cold climates because the temperature is not good enough for them to, breed and breed. So when temperatures increase, of course, the temperatures for mosquito breeding is favorable. But more than that, there are many other things that contribute to increase in Aedes mosquitoes and dengue transmission associated with increasing temperatures. So for instance, from laying the eggs to hatching of the mosquitoes, when the temperature is around 15 degrees, it takes like 39.7 days. So it takes almost 40 days for eggs to hatch and become mosquitoes. But when the temperature rises, so for instance, when at 35 degrees, it only takes 7.2 days. So the mosquitoes from egg stage to adults, the whole reproductive cycle becomes faster. And also, this is called the gonotropic period because it shortens. There's more time for female mosquitoes to be flying around, biting people, and taking a blood meal and transmitting dengue. The other thing is at higher temperatures, the mosquitoes bite more frequently. So the biting frequency increases, which again transmits dengue. And also with increasing temperatures, there is increased virus replication within the mosquitoes as well. So all these factors actually increase dengue transmission within mosquitoes. Next slide, please. So, and all this doesn't just affect dengue, it affects many other viruses, arboviruses, which are transmitted by Aedes mosquitoes as well. So like Zika and chikungunya. Zika is a flavivirus. Chikungunya causes really bad joint pain. And currently in Sri Lanka, we're having a chikungunya outbreak. So most of these countries in the tropics and subtropics, you see simultaneous transmission of dengue, chikungunya, and Zika. And with the increasing global temperatures, climate change, you do have countries which only had, either dengue, chikungunya, Zika. You have all three now, co-transmitting and being prevalent in these regions. And also, what is happening is certain viral infections, like for instance, Oropush, which was seen in Brazil and Latin America for many years, but only a very limited number of cases. Last year, there was quite a significant outbreak in Brazil. So instead of 10, 15 cases, last year, 8,000 cases were reported. So this is again to do with climate change. And the problem with this is with more intense international travel, when Oropush goes into some other countries, because of international travel, because of the presence of the vector, then those viruses also establish themselves in those countries. Next slide, please. And apart from these climate change, what the other things that happened as far as dengue is concerned is the change in age group who gets dengue. So earlier, although dengue was mainly a pediatric illness, now the vast majority of infections in most countries are among adults, and you have higher mortality rates as well in adults individuals, with declining mortality rates in children. Next slide, please. And with this, there are several things that happen when you have more infections in adults. So as I mentioned earlier, most infections are asymptomatic, with about 25% infections being symptomatic. But when more and more adults are affected, they develop these complications like dengue hemorrhagic fever instead of getting a milder version called dengue fever. And the risk factors which increase disease severity or the likelihood of getting dengue hemorrhagic fever is diabetes, hypertension, renal disease, cardiovascular disease, which are really not, seen in children. So when children got dengue, the risk of getting, severe disease is less, because these complications, more comorbidities are usually not seen in children. But when you get more infections in adults tend to have these comorbidities, and we also see an increase in these comorbidities in many countries, which also increase the disease severity. And the other important thing is you see more infections in adults, and then of course in pregnant women, which was not an issue when you saw infections in children. And when you see infections in pregnant women, they're more likely to develop severe dengue, and the case fatality rates are very much significantly higher in pregnant women than non-pregnant women. Next slide, please. So the main challenges due to this exponential rise in dengue is, of course, there are lack of point-of-care diagnostics that are more sensitive and affordable in countries where you have dengue. So these two pictures are pictures from Sri Lanka during a dengue outbreak. Then, because there are lack of prognostic markers, so when you have patients getting dengue, you don't know who is going to develop severe disease and who is not. So unless you actually monitor people, then they suddenly develop these dengue hemorrhagic fever and complications, and then the case fatality rates are very high. So because we don't have prognostic markers, anybody who has suspected dengue infections, then you have to closely monitor to initiate the right type of treatment. Now, when I say the right type of treatment, there is no treatment for dengue. So what we are talking about is actually fluid management. So the main complication of dengue is fluid leakage of plasma out of capillaries. So you have to replace the plasma in the form of fluid replacement, which is personalized medicine, because people leak different proportions. So somebody might leak a lot, somebody might not leak that much. So to give personalized fluid replacement in a context like this, you can imagine the nightmare. Okay, so but if you don't closely monitor people, you don't know who develops leakage, and you can't replace fluid in a timely manner. We do have vaccines, but they're not equally effective against all serotypes, and there is no efficacy in individuals who have not been infected with dengue previously. So this is one of the main issues. And As I mentioned, until recently, dengue did not affect high-income countries, so it was not an issue. And there was not much interest. And of course, with that comes very limited funding. So without funding for dengue, there is no way to find answers to any of these main issues that I have raised. Next slide, please. So how can we face these challenges? Of course, we need to increase viral surveillance to see how the virus is spreading, whether the emergence of new strains, and whether the emergence of strains match the strains in the vaccines, whether it reduces vaccine efficacy, and also non-detection by existing diagnostics with the emerging variants. Then better understanding of what causes severe disease, because without understanding that, it is difficult to have proper drug development, and also to understand what is associated with protection. And that is a critical thing to answer to develop safe and effective vaccines. And also we need better vector control strategies rather than just chemical fogging. The final slide of mine, if you go to the final one. So if we are to find solutions for dengue, we need global collaborative research projects and research efforts, adequate funding. I believe the main problem with these issues and not finding solutions for dengue is the lack of funding. And of course, involvement of all the stakeholders. So I'm very grateful for the Infectious Diseases Alliance for putting this webinar together and to bring attention, call for action, to create awareness for this so that we should be able to find solutions for dengue. Thank you.
Thank you so much for this presentation. And then, yeah, it's been very interesting to learn more about dengue and why it is important to, for example, get more funding. And yeah, it's thank you so much for presenting this. Then I want to go over to the next speaker, Mayani Edward. He will talk about the impact of climate change on vector-borne diseases. So I want to ask Mayani if I can present the slides for you, or do you want to present them yourselves?
Yeah, please go ahead. Go ahead.
Yeah, I will present them for you. Thank you. Then I'll give the word.
Yeah, good evening, everyone. Greetings, everyone. Good evening, good morning. Yeah, thank you so much. First and foremost, I would like to express how happy I am to be in your presence this moment. Thank you so much for the Infectious Disease Alliance to give me the chance to share my expertise on this very timely and important topic, where we'll dive more to look on the lays of the vector-borne disease. But first and second, I would like to appreciate the previous speakers. She has exerted a lot concerned with vector-borne disease, particularly on dengue. And I'm here to talk about the vector-borne disease in general, and later we will appreciate how best we can mitigate the challenges. So the second slide. Next. Yeah, I would ask everyone to reflect in this particular photo. I would like to share my story. Yeah, personally, I've blessed from the community, the village, and I would like to share the story of my father. Yeah, my father is a farmer living in a village where the rainfall was once predictable. You know, when you need to engage in farming activities, in back days, we were trying to predict the rainfall pattern and even the duration. But for the time I'm speaking, my dad now is facing a very serious challenges because the rain is no longer predictable, and now they are facing the on and off drought, and to some time they experience flood, and these pose the challenge where the stagnated pool that left behind after the flood become a permanent breeding ground for the diseases vectors. And with that regard, one of my family members experienced 3 episodes of malaria because of this dramatic change of the climate pattern. So generally, my story reflecting on the climate change pattern from the previous and the time we are speaking. So this reminds us that nowadays we are expressing the climate change, and its impact is really palpable. And even my family, I'm among of the survivors of this particular matter that I'm sharing today. So I'm really happy to share my story with you and even to learn together. So join with me when we are trying to dive among the vector disease and to look how best we can mitigate it. Next slide. Yeah, so generally speaking about the vector-borne diseases, it accounts for about 70% of all infectious disease worldwide. So, and the most predominant vector-borne disease that we are talking is malaria, dengue. We have a quite number of them, but I will dedicate my presentation on this particular two because of the presence of high number of people that are at risk, and even the death rate annually, and in particular for the vulnerable population. So the vector-borne diseases significantly impact a huge number of people, and multiple people are dying because of these vector-borne diseases. However, its impact are not well appreciated, but I can tell from the experience point of view, the vector-borne diseases are real and it kills a lot of people. Yeah, so I will concentrate more on these two. For instance, when I'm talking about dengue, the previous speaker highlighted a lot. It's about 3.9 billion people that are at risk. And the number of cases that are detected annually, according to the recent WHO report, is about 96 million of people, and most of the cases are symptomatic. Now you can see how big the problem is, where we have a multitude of people that are at risk of this vector-borne disease. And speaking to malaria, the number of cases that are detected annually is 249 million of cases that are detected. So you can see when we are speaking about the vector-borne diseases, we speak about the burden of the multitude of people that are at risk, and some of them they are succumb deaths. So next slide, please. Yeah, now how far this particular disease, the vector-borne disease, affecting people? What is the mortality rate? So speaking in general on the vector-borne diseases, it kill more than 700,000 of people annually, and most of the cases are from Africa. Yeah, and most of these diseases happen in a tropical area. So the tropical area, they face a severe burden, and most of the deaths are coming from the tropical areas, particularly in Africa continent. So speaking on dengue, annually, please, previous slide, please. Yeah, speaking about malaria, more than 600,000 people that are dying annually. So, and even then 40,000 people are dying annually. So you can see when you talk about these vector-borne diseases, we are talking about the burden that affect a quite number of peoples. But the question is, what are the determinant, or what are the triggers that precipitate this condition, so that we can know when we are targeting what could be the interest point for us to tackle the problem. Next slide. Yeah, so genetic distribution pattern is just a complex set where it touches some demographic, environmental, and some social factors. And speaking at the time, the environmental domain or the environmental component take a lead, where it have a significant and substantial impact when it comes for vector-borne diseases. So I will concentrate my presentation on the environmental aspect, where I will dive more on the environmental component. However, also we acknowledge the complexity of it by touching on demographic and some social parameters, including urbanization and others. The next slide. Yeah, so the question is how climate change is expanding their reach. We have witnessed that from the story, we can reflect and tell that the climate change led to the very serious impact. But at least the previous speaker tried to highlight how the climate change exacerbate the transmission dynamic of this vector-borne disease, focusing on dengue. But I can summarize generally, I don't want to repeat, but generally I can summarize that the impact of climate change toward the transmission dynamic of the vector-borne disease is very palpable. And generally, we appreciate that due to the change of the climate, it creates a room, just avenue for the expanding vector range. We have appreciated that and even the study indicated that, for instance, when there is a warmer temperature, when there is a warmer temperature, it allows vectors like mosquito, tick to survive and even reproduce in a prevalent hospital areas. And this led to the expansion of the geographical range and bringing the disease to a new population. And also the climate change, it can increase even the vector activities, because when there is a higher temperature, can accelerate the life cycle of the vector and even leading to the faster reproduction rate. And it also increases the biting frequency. Now you can see how the environment, when we talk about the increase in temperature, how serious it is when it comes for the vector and transmission dynamics. So this can result in a great disease transmission because of the higher temperature. And we really agree that, and we can tell, for instance, for the place that I'm living, the temperature is very hot. Now, if the temperature is very hot, what do we expect is true that the life cycle of this vector really accelerated. And that's why we are still experiencing the transmission, the greater transmission dynamic. Also, the issue of climate change can even alter the pathogen development, because the climate change can affect the development of the pathogen within the vector. For instance, the warm temperature also can even shorten the incubation period of the virus mosquitoes, making them infectious sooner. Speaking on the rainfall pattern, also the altered rain pattern can increase, for instance, the flooding and the drought can create or just eliminate the breeding site for the vector. So flooding can create a stagnant water pool, ideal for the mosquito breeding. And for speaking of the drought, can even can concentrate the vector population in a limited vector source. So it's a very serious business when we talk about the effect of climate change toward the vector. Also, speaking on a weather event, we have witnessed a lot of the weather events. Speaking to my nation, speaking to my country, and even in my local area, we have witnessed a lot of the weather events that have a very serious impact. Speaking of the flood, last year we experienced a flood that disrupted the public health infrastructure and even displaced population, making it harder to control the vector-borne disease. So the extreme weather condition is well palpable and is alive and well, and it exacerbates the transmission dynamic of this vector-borne disease. Furthermore, even the ecosystem. So the climate change can alter the ecosystem and affect the interaction, and even affecting the interaction between vector, pathogen, and host. And this change can create a new opportunity, can create a new opportunity for the disease transmission. So generally speaking, the impact of the climate change, it touches several determinants, but all in all, it aligns for this. It aligns for the starting from the ecosystem. It touches the vector itself. It expands to pathogen development, change the rain pattern. So it's a very complex matters. But the question is, the climate, these several factors, we agree have expanded the latitude and attitude and the rain season during which can active increase. But I can tell this trend I expect to continue as the climate continue to get warmer. But the question, how best can we mitigate? The second slide, the next. Yeah, please, the next we have already. I have included some of the detailed concerns with how temperatures affect. I have elaborated everything. The next slide, please. yeah, the precipitation in humid can affect, and it increase rain can create a more breeding. I'm already explained about it. Can you please go ahead? For the interest of time, yeah, extreme weather event, yeah, please go ahead. Yeah, so the question is, after understanding how climate change can impact, impact the vector-borne transmission disease, the question is, how can we mitigate now? How can we mitigate, how can we solve the problem? Next is right. Yeah, so first and foremost, among of the very important approach that we can use is to integrate the vector management, because when you talk about the vector-borne, we talk about the vector transmission. Now, how best can we tackle the problem is by integrating the vector-borne integrate the vector management, starting from the environmental management, the biological control, and even the chemical control. So when we think about tackling this particular problem, we need to come up with a very robust integration on the vector management, touching from the environmental management, removing the stagnant water, improving the drainage, and even the cleaning of some debris, and even to think on some biological control, and even to use insecticides like pyrethroid in targeted and irresponsible manner. That is the first approach that we can think about it when we think about mitigating the challenge. Second, next slide. Yeah, so second, we need to strengthen the public health system. Yeah, we need to strengthen the public health system in a manner that to have a very robust surveillance system and even early warning sign, so that it can help us to be alert, so that we can intervene promptly. So the surveillance, we need to have a very robust surveillance system, a surveillance team, and early warning system. Whenever happen, we need to be very alert, and this is very possible if we could strengthen more on the issue of the surveillance approach. Also, we need to improve diagnostics and treatment. I know we have a lot of patients, but we need to come up with the accurate and the timely treatment. Also, end of the game, because we're talking about the public, we need also to invest on the community engagement, or just community outreach, so that we can capacitate and educate the community and to empower them even to participate in this vector control and disease prevention, because this is not a battle for medical doctor, it's not a battle for clinician alone, it's a battle for everyone. So it's very important if we can strengthen the public health system and even capacitate the community. Next slide. Yeah, so we have a climate change. What we can do, we need to create the adaptability. Now, how best can we create the climate change adaptability? It is starting from our planning. It is starting from our designing. So we need to have a very clear urban planning, and also we need to create a climate resilience infrastructure. For instance, starting with the building, we need to come up with the building that will restrain the extreme weather event. We're talking about the flood. We are talking about the increase in temperature. So how best can we create the climate? How can we best tackle this? Is by creating the resilience infrastructure. Now we need to adapt and even to act accordingly because of this particular problem. Also, on top of that, urban planning is very crucial. So we need to design a green space and even the water management system to reduce even the mosquito breeding site. Next thing. Yeah, also we need also to recognize the issue of One Health initiative, because also we need to recognize the interconnection or interconnectedness of the human, animal, and the environment in this particular matter. So most of the days that you are talking, there is just an interaction. Consider like we talk about the ecosystem. So we need to appreciate the issue of the human, animal, and environment rights. And even when we are tackling this particular problem, we need to think about multidisciplinary approaches so that we can tackle this problem as a team, because it's not the battle of the doctor. It has some interaction with the environmental expertise, animals, and even humans. So it's the time for us to collaborate to ensure that we have a very strong collaboration between physician, environment scientist, veterinary doctor, and other expertise so that we can tackle this particular problem. Next slide. Without forgetting the role of research and innovation. So when thinking about tackling this particular problem, we need also to invest on developing new vector control tools and to foster the sense of innovation so that we can come up with the vaccination and even the treatment approach that could ease the process and at least could tackle this particular problem. Also, we need to think about coming up with a climate model that to predict the future disease outbreak. I appreciate we have some of them, but we need also to invest more on research and innovation so that we can come up with the tactics in the way of a new way of addressing this particular problem. Because remind you, this vector, day in day, they change their behavior and pattern, but we need also to invest more to study their behavior and sometimes to think on the appropriate way of addressing this particular problem. Next slide. Yeah, so general, my call to everyone is we have a climate change. Now it's our duty to change the narrative. It's the time for us to challenge the status quo. It's the time for us to write a story of resilience, a story where science and compassion trump over the adversities. Let us work toward a future where everyone in every village and city can live free from the threat of these diseases. So together we can. Let us change the status quo. So it's my hope that after this particular webinar, all of us we are going to be an ambassador and even share the message with our community and colleagues to tell about this particular approach that we can use, and even to read any a intervention or just program that will tackle this particular problem. So I understand that might not be a priority to most of the country. Probably when you talk about dengue, it's not a priority, but remind you, its impact is well palpable and is arrive, and where let us come together toward a future where everyone is free from this disease. Thank you so much for listening to me, and thank you everyone, and thank you again for the Infectious Disease Alliance team. I submit.
Thank you so much for this very interesting experience and very interesting PowerPoint presentation. Thank you. I want to give the word very short to Carl. He has something to say, and then we continue.
Thank you, Iris. Since Dr. Nilika wants to leave the webinar and in less than 5 minutes, I have a question from you, Nilika, that what steps can communities take to protect themselves against dengue in the absence of an effective vaccine or treatment?
So that's a good question. And of course, communities living in tropics and subtropics have been experiencing dengue for over 70 years. So which have been, increasing intensity. And so what everybody does is, cleaning, getting rid of the breeding sites. And of course, the governments currently do chemical fogging, but it would be eliminating breeding sites, cleaning, getting rid of stagnant water, getting rid of garbage that holds small water collections and so on. But cleaning your roof gutters so that you try to eliminate mosquito breeding places as much as possible. But having said that, so there has been intense these community cleaning programs going on. And in some countries, like for instance, Singapore, they actually go into houses looking for mosquitoes, and even even countries like Sri Lanka, find people for if you have mosquito breeding places. So despite all these being done, we know that the cases are increasing. So because you can get rid of all these breeding places, but even small collections of waters in banana leaves or leaves of trees is enough to for mosquitoes to breed and transmit. So obviously community engagement and cleaning is important, but so far the only focus of stakeholders has been community engagement, getting rid of the vector, controlling the vector. And it is evident that that has not been very successful, isn't it? I mean, the cases have been increasing. So I'm not saying that you don't need to do this, you do need that, but doing that alone has not been, successful. So you need integrated strategy. So you do need good diagnostics to identify, you need prognostic markers so that you identify which patients are going to get severe so that you don't need to admit everybody with dengue, like warning signs or showing could potentially develop complications into hospital. So you can't manage hospitals. You need treatment because personalized fluid treatment is not an option. It has been successful. We have reduced case fatality rates, but when there are large outbreaks, personalized fluid replacement becomes really, really difficult. So we need treatment. And of course, we need better vaccines. We do have vaccines. They're not equally effective against all serotypes. And as I mentioned, the efficacy in people who've never been infected with dengue is quite low. So, and there is waning of immunity. So there are lots of questions. And the reason why we don't have answers or solutions to these is because of, lack of funding to look at these things. So we really need global efforts and funding for people to find solutions. Thank you.
Thank you for your insightful answers, and thank you for your time for today.
Yes, sorry, I have to join another meeting because it was mentioned. Sorry about this.
No, it's okay. Yeah. Back to Iris, and our panel discussions will continue.
Thank you, Dr. Malika, for joining us. Yeah, we'll go to the next question. Let's see. How can technologies like predictive modeling and advanced surveillance help us to stay ahead of vector-borne diseases, and what role do everyday people play in these efforts? So I want to ask this to Mayani Edward. And yeah, if someone has another something else to add, then please let us know. Raise your hand. Mayani, can you give us a word?
Yeah, thank you so much for the question. The question, how can new technology like predictive modeling, advanced surveillance help us to stay ahead of the vector-borne disease? And what role do everyone play in this effort? Yeah, so thank you so much for the question. Thank you so much for the question. Yeah, so generally what I can say about the technological advancement, particularly talking on the predictive modeling. Yeah, so general predictive modeling use climate data, epidemiological data, and even the vector is the vector ecology to forecast the outbreak and identify high risk area. So the mathematical modeling can be used to predict the spread. Can be used to predict the spread of the disease based on the variables such as temperature, humidity, and even the population density. So I also the technology advancement, it helps us also to advance the surveillance approach or just surveillance system. For instance, the using of remote sensing and even mobile technology to track mosquito population and even the disease transmission. It brings hope for the advanced surveillance. Mind you, among of the tasks that I mentioned to tackle this particular problem is to focus on the surveillance. So the advancement technologies is a game changer in a manner that it advances the surveillance. For instance, also utilize the sensor network to monitor environmental condition and detect the breeding site. So it brings hope. Also, for instance, we have the genomic sequencing to monitor the evolution of the vector and the pathogen. So generally, to me, the advancement it brings up for the advanced system. And interesting, now we are living in the world of artificial intelligence. Even AI that are used to analyze the large set of data to identify the pattern and predictive modeling. So we can tap into it by using the artificial intelligence also to analyze our data, a large set of data, so that we can clearly understand the pattern and even predict the outbreak. Also can be used also to aid in discovering new drug and vaccine. It makes the science be easier. We have the concept of the citizen science as well. We have a mobile app, we have online platforms that allow individual to report the mosquito potential breeding site or sighting. So the second part is now what is the role of everyone in this particular limb or dimension. So the rule of everyone, first of all, we are focusing on the breeding site. So everyone, we should at least everyone have a duty to make sure that we are working hand in hand to eliminate this breeding site, to remove the standing water from the container around home, maintaining clear, maintaining the environment clean, and even training system. Also to use the personal protection, to use the mosquito repellent, wearing the protective clothes, and even using a mosquito net. So in tackling this particular problem, everyone has a duty. Also, reporting mosquito sighting or just suspected case to health authorities, and even sharing the information about the prevention method to the family and the friend. Also, we need to voice up and even sharing the information as much as you can. Also, scientists and researchers, they have a good initiative, as we have a duty to participate in these citizen sciences so that we can, for instance, using app to report the mosquito activity and even contribute to the data collection so that they can come up with the new tactics and development and new tactics and development and the innovation and invention about this particular problem. That is my contribution. I submit.
Thank you. Thank you for that insightful part of the discussion. It's very interesting to see this as well. We will continue after this with a Q&A session. PC. So Dr. Nelika has left, but are there any questions that are for Marianne Edward? Then let us know and you can raise your hand. And otherwise we'll start with the ending of the webinar, since we're also a little bit of over time. But let us know if there are any questions. I want to start with summarizing some key takeaways from our webinar. So Dr. Nelika addressed some of the public health preparedness for dengue in the context of the changing climate. And Marianne Edward focused on the broader impact of the climate change on vector-borne diseases, and both of them highlighted the urgent challenges that are posed by these diseases, and also the need for innovative approaches. During the panel discussion, they emphasized the role of the technology and community engagement in the combating of the vector-borne disease outbreaks. So what is next? We will talk about the call to action. We have made a call to action on vector-borne diseases because we find it very important as the Infectious Disease Alliance to bring everyone together and to collaborate on these issues, because only with each other we can make more impact. So about the call to action, we made several statements, and we want to ask you if you can sign this call to action as well. You can find it on the website, and the link will be shared in the chat here. After this, on our next steps, as the Infectious Disease Alliance, we urge you to combat the different vector-borne diseases, what we talked about today. So we want to advocate and to push for increased funding for research and for policy initiatives that prioritize prevention and the control of the vector-borne diseases at national and on global levels. And we want to urge you to engage as well with us and other organizations to work with communities to implement sustainable solutions, to promote awareness, and to support interventions that reduce disease transmission. And at last, we want to collaborate and to share and to stay informed and to spread awareness on vector-borne diseases, and to explore different opportunities to continue the ongoing effort in the fight against vector-borne diseases. So as the IDA, we remain committed to supporting research, innovation, and advocacy to combat these diseases. And we want to ask you to stay connected and to join our future discussions and our future webinars, and to take action also within your community. Yes, after this, I want to close the webinar, and I want to thank all of you for joining the webinar, and I highly recommend on going to the website and also join the call to action. So thank you as well for joining, and I hope to see you again soon, and I wish you a very nice day. Thank you all.